Hi all, my name is Sian Gadamu and I work for the Aspen Global Innovators Group. Thank you all for joining today's live Aspen Health for All conversation. These conversations are part of a larger effort housed at aspenhealthforall.org that is amplifying the important work being done by leaders and innovators all over the world to address these disparities that have been amplified by COVID-19. Our aim is to focus on health equity and connect a range of experts working on the front lines of health around the world as we all pivot to respond to the challenges of COVID-19. We are in search of common solutions and shared insights. And as the US reckons with the legacy of racial injustice and the continued systematic oppression of Black lives, we want to take this moment to say we will not tolerate violence and hatred against Black communities. Our global community stands tall with local leaders, collaborators, healers, and fellows who have long been beacons in the movement and whose voices and work are critical to reshaping the healthy, equitable future for all. Today, the Aspen Global Innovators Group is excited to host a conversation with Dan Glickman, who will be moderating today's discussion. Among the many hats Dan wears, he is the executive director of the Aspen Institute Congressional Program. He served as the United States Secretary of Agriculture from 1995 to 2001, prior to which he served as one of Kansas congressmen for 18 years. Joining Dan today is Esther Ngumbi, a 2015 Aspen New Voices Fellow and an Assistant Professor of African American Studies and Entomology at the University of Illinois. Esther focuses on beneficial soil microbes for improving crop production. Welcome, Esther. And Dr. Cedric Habiyaremye is a crop scientist at Washington State University who introduced quinoa to his home country of Rwanda as the founder and CEO of Quinoa Hub. Welcome, Cedric.
Thank you for having us.
Okay, I assume it's time to start, and first of all, I thank Aspen Global Innovators and you all and my friend Peggy Clark for helping to arrange this, and especially Cedric and Esther for their participation and their leadership. And so, I think the COVID-19 issue, this public health issue, is something that I haven't seen anywhere in my lifetime, and I've lived a lot longer than probably most people on this call, certainly longer than Cedric and Esther have lived. And it's having an impact across the board in every country in the world. But I wonder if you two, starting with Esther, might just generally and quickly talk about, you're an entomologist, you've been involved in hunger, agriculture, sustainability, soil health, and how you see this impacting agriculture in Africa, particularly smallholder agriculture, as it affects production and as it affects hunger. I'm going to ask you both the same question, but we'll start first with Esther on that.
Thank you so much, and everyone that's tuned in. So definitely, even before COVID-19, the number of people that were hungry in Africa and in the African continent was around 239 million. 239 million. And mostly the affected are smallholder farmers. And these are farmers that farm on less than 2 acres of land, and farmers who are facing the impact of climate change so much that it is manifested in the form of droughts that continuously have affected and hampered the ability of farmers to really produce and make the most out of their 2 acres of land. So that's pre-pandemic. And when the pandemic hit, that meant that everything came to a standstill. And I come from the Kenyan coast, and we practice farming up to today. How did that impact us? So that meant that we couldn't get our agricultural inputs, seeds, fertilizers, because of mandatory stay at home. And we could not get even what we had in the farm to the market. So it's really been a tough time for smallholder farmers. And so that's a crisis within a crisis. And then as an entomologist, even before the pandemic, the desert locust invasion and the fall armyworm invasion as well, that made it difficult for farmers to even get the crops from production through harvesting period. So here we are dealing with multiple set of crises within crisis. And it's really impacting the farmer because they are dependent on these crops to be able to get through the production period, which is typically 3 months. And so here you are, you can't produce because of drought, floods, and when you even make it to produce, the insects take it away. And then you can't get it to the market because of the mandatory closure. So it's really been hard. And that's why it is important that the global community, that the African governments really make it a priority to ensure that we act right now to prevent this crisis from becoming a global calamity and really a human crisis. Thank you.
So I just ask you one more question on that, and then I'll follow up with Cedric. In terms of the amount, the numbers of cases of COVID in Kenya, let's say, is the number moving up dramatically? Are we seeing a rapid increase in number of cases? Are the numbers stable? Do they tend to be in urban versus rural areas?
I was reading actually this morning, so we are at 4,000 cases, and that's Kenya is a country that has roughly 46 million people. So the case, and they are seeing a rapid rise into the cases that they are beginning to show up, and mostly affected are actually the urban slums, and that's actually putting another really damper because urban slum dwellers cannot produce food. So take, for instance, people in Kibera slums, which is the biggest slum in Africa. And these cases of COVID are more in the urban area. So Nairobi, people cannot move. And so that ability to bring in food and bring out food is constricted by the COVID-19. And so here you have stay-at-home orders in Nairobi, where people are dependent on being able to get out and work so that they can feed their families. They don't have access to growing areas like we have community gardens, so they cannot produce food. So that is another crisis within the bigger crisis. Urban areas not able to get the food, and the cases rising every day.
Thank you. So Cedric, first of all, I'm delighted to see you. Met you at Chicago Council events. You're quite a distinguished scientist yourself. I wonder if you could answer the same question that Esther did, is that how do you see this crisis affecting smallholder farmers, both in Rwanda, but perhaps elsewhere in East Africa, and then a little bit about the demographics of the disease that Esther commented on as well.
Thank you, Dan. It's good to be here, and thank you for the opportunity. I think Esther did a good job of laying the foundation of pre-COVID, but let me focus more on the COVID crisis on the food security of farmers in Africa, and I will give more examples, especially Rwanda and other countries from my experience. Most of the disruption has happened on the supply and the demand. Some farmers cannot access the input, and they are also sometimes afraid of working in the farm because they think they will be affected or get the virus. Because of the restriction of when there was a lockdown, for example, in Rwanda, they didn't have their own means of transportation to take their produce to the market. And the people in the city, they couldn't be able to access the food. Basically, in some places, farm production has stopped, and in other places, food is produced but it cannot get to the market. And this has actually caused many problems, especially we know relatively a few people in Africa can work from home. So some people start losing their jobs, which pose the issues of food affordability, even if they can make it the farmers can make it to the market. So their incomes has been shrinked and they can't feed their family. So the issue now is no longer to only to the farmers, the smallholder farmers in the community, but also is taking a toll to the whole from rural communities and to the urban areas. So then when it started affecting the economy in that way, for example, in Rwanda, they started like loosening up a little bit for the lockdown and then allow some travels. And Rwanda, I would like to mention a little bit that they did a good job of restriction. The lockdown, they started very early where they controlled the dissemination of the disease, the spread of the disease. But when they started loosening up because of the economy was being affected, now the cases that are growing up, and those are being mainly witnessed in places like that are neighboring on the borders, like the part of Rusizi neighboring to DRC and some other part of Tanzania because of the movement of the goods. And then some people now are migrating to the rural area, which means now the cases are going witnessed in the rural areas. And this make me so concerned to that we know what happened during the Ebola outbreak in West Africa, where around 40% of the farmland remained uncultivated because farmers got sick and they also were afraid to go farming. So imagine what will happen. Like Esther said, it's a crisis within a crisis, and it's gonna get worse.
So I would ask you both, I wonder if you could drill down a little bit in terms of, has this contributed to food shortages? And if so, where, and what can be done about that? Esther, you might want to start on that.
So I think, yes, it's contributed to food shortages and building on what Cedric has said. So that inability to really be able to move food from where it is grown to where it is highly needed. So for example, from the rural Kenya areas to the urban slums where it's important that they are able to access it. So that brings about shortages. Secondly, so as we talked about just having climate change that has already made it impossible. Like just even this week, I was in communication with farmers in my community, and now we're having a fall armyworm invasion. So making it even, the production is being hampered. So you have the challenge of you can't get the food where it is needed. Secondly, we have real on-the-ground challenges, the same challenges, pests. And then, of course, I didn't mention about already soil degradation that has been an issue that continues to prevent African smallholders from truly using the little land to produce enough food for all. So indeed, yes, there's food shortage, and that's why we're seeing people trying to move to the rural areas because that's where there's land, because already most of the African cities haven't really thought about urban farming, ensuring that people that are living in these urban areas have access to food, have access to land to be able to produce this food. So these are already, before the pandemic, there were already existing challenges to the food systems. And that is just continue now to be, actually now that's when it's being exposed to our policymakers, to our governments, to see all these little connecting things that we hadn't connected before in our food systems. And I hope that we can use now this opportunity to really rethink, re-strategize, and rebuild an efficient, equitable, and a very connected food system.
So just quickly, how is your government responding to all of this?
So that our government has responded in trying to really ensure that they give cash to the farmers, but it's not yet there. I don't think it's trickled enough to the vulnerable. And there's a lot of inaccountability. So I think even moving on, there's need for transparency. So if the government says we have done X and Y, and track the money track the resources so that we ensure that the vulnerable get the help. That when the government said, okay, we are doing this and that, we can see it. And so we live in the era of cell phones. We can be able to ensure that farmers say, yes, they verify that I have received what the government is pushing. So I think while the government is saying we've done this, I think there's still that lack of, is it there? Has it been received? And can the people, the recipients say, here it is. This is the stimulus that the government sent. This is the subsidies that the government is allowing us to able to get the inputs that we need. So that there's more talk than action. It is time to really act and transparently and accountably act.
So Cedric, I wonder if I could ask you the same question, both relating to food shortages as well as how the government, the Rwandan government or others are trying to deal with this particular problem.
So overall, before I get to the Rwandan government specifically and other government, overall, all the governments, there is a need for a collective action to mitigate the impact of food. Assistance program should be in place and should be maintained. I see them in like what I can call maybe 5 actions that are needed. One is to maintain an open trade and keep the supply of food flowing across the continent and the world. And also to ensure access to nutritious food and affordable food for all, like through food assistance, for example, but also making sure, for example, speaking on the food assistance program, Rwanda has started, providing food package to families that were affected a lot. And I remember one of the work we worked on with the food systems for the future, we were also adding the nutritional package on the package that they were sending. So basically not any kind of food assistance, but making sure there is a nutritious food assistance. And I will tap on this as I talk more about this. And also there should be food price control. Because there was I remember during the surge of the pandemic, there was some retail market, they started increasing the price of the food. And I know Rwanda was number 1 in the country, on the continent to make food price control. And South Africa was the second. Some other countries did that too, but some countries did not. And this has made it hard for everyone to afford food. And then to make sure that agriculture is an essential function. In some countries, some farmers were actually restricted to continue to work. But I remember in Rwanda where they say anything that related to agriculture to continue moving because they recognize the importance of availability of food to the people. However, all these actions are not enough for long term. If you want to, there is a few things that are needed to withstand future disaster, not just the COVID, but also what needs to be done on the continent to avoid everything that will come, not just the COVID. So we need to fix our food system to withstand this disaster. That means investing in sustainable resilience food system. This to happen, food security during pandemic and post-pandemic must be viewed through the lenses of public health and nutrition, rather than producing a lot of calories. I'm saying this because, for example, over the past decades, food systems in the developing countries have changed dramatically. Research institutions have been prioritizing higher yields over nutrition, and nutrition, I believe that should be an integral part of food security because proper nutrition drives resilience, stability, and prosperity. And people need to be as healthy as possible right now because we know that COVID, even though affects older people, but when it comes, there have been some studies that have shown that even people who have pre-existing conditions, they are also susceptible, which means malnutrition, if it gets to the people who are malnourished, it's going to be a disaster. For this to happen, we need to sow the seed of agricultural and nutritional resilience on the continent. And moreover, there is an urgency to establish a system that helps farmers have access to market and make the production available to consumers.
So I think you've raised a very interesting issue about the relationship between nutrition, public health, and smallholder agriculture. And I wonder, Esther, you might want to comment on in whether it's in Kenya or other countries in Africa, does the government kind of coordinate the relationships between public health and smallholder agriculture and nutrition? I know that for example, in Ethiopia, there's been an attempt to try to have these little extension networks out where people can be trained to deal with both health and agriculture issues. And I wonder whether that has any positive potential in other countries as well.
I think it has, and one thing about what COVID-19 has exposed all these very interconnected systems. I think we've realized that food systems are so much integrated in our public health systems. And so I think moving on, I think this is an opportunity once again for the African continent, for the African governments to truly now get back to the drawing board and to map out, to realize all these connections that just have been exposed that now can be used to come up and map really very interconnected solutions. I always, as a soil proponent, starting with the soil, because we know without healthy soils, we cannot attain the production, the nutrition sensitive crops that we need. Then moving on to the type of inputs that our farmers can grow. How can we tap onto science to have improved varieties that deliver not only the carbohydrates, but deliver both nutrition-wise? So, for example, maize is a staple crop. How can we ensure that the maize millet has both vitamins? It is fortified. So when farmers produce it, it's both drought tolerant, it's building onto the soil, and it's providing the nutrition that is needed. Then how then do we also ensure that we have foundational things that are needed for agriculture to thrive? That is water. We know climate is going to be a problem. How do we ensure then there's the flow of science evidence from the labs to the farmers, extension, using the available channels, ramping up our technology and our ability to deliver from our labs straight to the farmers, and ensuring that they have everything they need to thrive. And also tapping onto the local initiatives, NGOs who have already been in these countries, tapping on the power of World Food Program that has already all the logistics covered. How do we tap onto these existing systems to truly ensure that the threats of COVID-19 and food security are really taken and we solve these issues once and for all?
So, and I would maybe close with Cedric to comment on what Esther said, and what is the best way to kind of put all these pieces together? In one sense, it almost looks like we have a biblical plagues happening simultaneously: pests, disease, health, famine in some cases, climate-related issues, and COVID is just one more factor on top of everything else. But sometimes that one more factor can really cause the whole system to fall down. And so how best to coordinate all these efforts?
I think the best coordination in this, if we start seeing that food security, we see it in the lens of public health, that will make every sector involved. So there is a need of interdisciplinary collaboration approach to make sure that all the aspect to make sure that food as a foundation or as the right of all the people on the continent is meeting all the needs of the general population. So this involves also to promote the crop diversity, the agro diversity. That, like Esther said, we have all this issue of pest and disease, but we know in a lot of countries, promotion of crops like maize versus other crops that were indigenous has also caused, like, promoted the monoculture, which has affected the ecosystem, and that has been a hub of all those other issues. And then I believe that crop diversity will bring the nutritional diversity that is needed on the continent, and then people will prosper and will be healthy to be able to withstand to be able to be productive and withstand future disaster.
So I think we're approaching kind of the end of the discussion, but one quick final question is the global community been of much help in terms of the World Health Organization, the FAO, the World Food Program, and also the US in terms of USAID? Has the global community been much help on the COVID crisis in Africa, or East Africa particularly? Either one of you. Cedric?
Yes, they've been involved since actually not just the COVID, even before, but even during the COVID, they started providing assistance, which in different forms. For example, USAID and World Food Program, they provide food assistance for different governments to make food available to their people, and World Health Organization finding ways to come into the health sector and supporting the health sector. So they've been supportive, but I think now this is the time to look and reevaluate from the past and now what needs to be changed in the strategy of those kind of assistance. How should be organized or be like structured to the point that is going to provide the long-lasting solution, and also actually trying to find a way you can create maybe a resilient system on the continent, not always to depend on the assistance.
And Esther, you want a final comment on this point, perhaps?
I think, like Cedric, yeah, the presence of the United Nations World Food Program, United Nations Food and Agriculture Organization, these are like boots on the ground. Now is the time to rethink, because definitely it's clear that what had worked before is not working, that we need to go back and really rethink of all the food systems and rethink how to build resilient African food systems, because just right now we know the aftermath of COVID-19 is likely going to be felt for many years to come. And if we do not act now, and then of course we know these are national security issues, because hungry people, that also breeds terrorism. It brings other things, that this is the time to act with urgency and like never before. I think collectively we have the will, we have the power, we have the financial capacity, and we have the brain power as well. If we unleash every resource collectively as a world, we can thrive, not only in the African continent, but everyone. I think this is the time to join hands and to rebuild a resilient global. It's now no longer African, but global food systems.
Well, all I can say is that to have you two on here gives me great hope and promise for agriculture generally, as well as for African agriculture. Your leadership, not only at major universities in the United States, but I know your interest and involvement in seeing that your home countries and the whole continent of Africa deals with this COVID crisis and other related crises in a comprehensive way. So I thank you both and thank the Aspen Institute for sponsoring this. I'm going to turn it back over, I think, to Xian, right? And you've got a visual for us to look at. Is that correct? I believe that there is an action plan that's from the Aspen Global Innovators. It's supposed to be on the screen.
Dan, I think it's up there and we can all see it. Thank you so much. It says how you can support Esther and Cedric and other organizations' work. I hope you can hear me, but it looks great and everyone can see it.
Okay, thank you very much, Peggy and everybody else, and especially Esther and Cedric. Thank you for your great leadership. Delighted to participate with you this morning.
Thank you, Dan.
Thank you, Dan.
Thank you all
Appreciate
for
it.
having
Thank you,
us.
Aspen.
Okay.
Yeah.
Bye-bye, everybody.
Bye, everybody.
Bye-bye.
Bye, everyone. Thanks so much.